Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the gastrointestinal tract disorder. Introduction: the digestive tract is no long muscular tube that moves food and accumulated secretion from the mouth to the anus. The GI tract include all structures between the mouth and the anus. The tract itself is divided into upper and lower tract. The upper gastrointestinal tract consists of the esophagus, stomach, and duodenum. The lower gastrointestinal tract include most of the small intestine and all of the large intestine. The exact demarcations between the upper and the lower tract is the suspensory ligament of the duodenum, also known as the ligament of Treitz. Ligament of Treitz. Disease of the upper digestive tract. Gastroesophageal reflux disease. It is a chronic symptom of mucosal damage caused by the stomach acid coming up from the stomach into the esophagus. Although this can occur normally, it may be attributed to GERD. If it is associated with the symptoms, GERD is usually caused by changes in the barrier between the stomach and the esophagus, including the abnormal relaxation of the lower esophageal sphincter, which normally hold the top of stomach closed. In a healthy patient, the angle of his the angle at which the esophagus enter the stomach create a valve that prevent the duodenal bile enzymes and stomach acid from the traveling back. Inflammation of the sensitive esophageal tissue. Factor that can contribute the GERD, hiatal hernia, obesity, Zollinger Allison's syndrome, which can be present with the increased gastric acidity due to the gastrin production. Hypercalcemia, which can increase gastrin production, leading to increased acidity. Obstructive sleep apnea. Next, the gallstone, which can impede the flow of bile into the duodenum, which can affect the ability to neutralize gastric acid. Next is the signs and symptoms. Heartburn is the cardinal symptom of the GERD, and it is defined as a sensation of burning or hot or heat that spread upward from the epigastrium to the neck. Chest pain is another important symptom that is related to the disorder of esophagus. Dysphagia is also a common presenting complaint that may serve to promote the dentist to refer the patient to the patient physician. There are next is the expulsions of the material from the pharynx or the esophagus. Other symptoms include pain with there are the swelling or sore throat, swallow, increase the salivations, also known as the water brush, nausea and coughing. So in today's class, I discuss about the following signs and symptoms of the upper gastric digestive tract. Thank you for watching.